Mr. Kagan, it's my pleasure and privilege to have you in my office today. And once again, I want to appeal to your professionalism, to your knowledge of people's interests.
Inner circle.
yeah, right. Yeah, so basically, I think you know what I'm talking about. What's the topic today?
I think we can talk about a subject that people are raising very often, and they're not taking it seriously, but like, as you know, liver is a very important part of our body, and the only thing people know publicly about liver is like it's very damaging to drink alcohol because it will affect liver. But otherwise people don't know importance of liver, how it should be treated, and how it should be any kind of problems and diseases should be prevented, and why it's so important, and what should be done besides eating proper food and not drinking alcohol.
Yeah, liver is very important, and I think from what you said, we already know that liver is extremely important in detoxifying bad things, you know.
So it's not just alcohol?
No, not necessarily alcohol, but alcohol is one of the most important ones. The another thing is that, as you know, liver produces enzymes that help in help digestion. Okay, you know, there is a gallbladder, so it.
I did not know.
Yeah, so that gallbladder collects this stuff from the liver, and as soon as a person eats, it's the gallbladder contracts and expels bile into the gut.
So it's not just alcohol, so it's also food?
Food.
And what about spicy food? You sounded like all kinds.
It helps in digestion.
All kinds of food.
And also mostly fatty foods.
Oh.
And also it's important in synthesis some proteins like clotting factors. It's extremely important, and basically we can talk about that because no, let me give you an example. Have you seen a woman with some kind of veins that can be clearly seen?
Yes, of course.
Yeah.
All the time.
Yeah, so basically, why does it happen? It happens because there is a clotting. Clotting factors prevail, and there are some very small clots that damage the veins and create that appearance.
But what does it have to do with liver?
Well, because liver produces clotting factors.
Ah, okay.
Well, but the next question is, why does it happen?
Why?
Why? You want to know everything I say.
Well, of course, that's the whole topic.
Yeah, because see, our body is perfect. It's perfect. It should not do that. So why would women have this issue?
Yes.
And one of the most common reasons why is that because liver starts producing too much clotting factors and too little anti-clotting factors. Why? Because women's hormones like estrogen, they're promoting the synthesis of clotting factors. And if there's a normal clearance of estrogen, there's no problem.
Okay.
But imagine there's a problem in clearing estrogen. Like, you know, estrogen normally clears by connecting with the bile acids and going outside.
So you started to use a lot of, I would say, specialized terms that I'm not familiar with.
That's very simple.
Yeah.
Let me explain. So basically, the problem why women have veins is too much estrogen.
But why too much?
Why does it happen?
They eat something wrong, they do something wrong,
Hold on.
smoking or whatever.
Because it's not eliminated. Why it's not eliminated? Because what happens, the complex bile acid estrogen is cleaved by bad bacteria. There's a bacterial overgrowth and starts recirculating.
But it's all why? Because people eat wrong stuff,
Exactly.
drink wrong stuff, smoking,
eat,
it also affects
antibiotics.
antibiotics.
Of course
Yeah, that's another thing I've heard about liver, that if it's a healthy liver, antibiotics, no problem. Like if person like temporary sick and taking antibiotics, if it's a healthy liver, everything will be fine.
No, there is nothing to do with this.
Correct?
It's not about the liver, it's about the microbiome. Listen, the thing is that they started talking about bacteria in our gut many years ago.
Yes.
And nobody actually listens to that. But right now, almost all mainstream journals
Experts,
are full of microbiome, full of the articles about microbiome, because it's so important, and you know why? Because the genetic material in the microbiome 10 times as much as our own.
So, but another question, simple question to ordinary people, not like professional medical experts or hospital leaders or anything like this. What particular food or drinks or water, I know you're a fan of water, etc., could be helpful to preserve healthy liver?
Healthy liver is basically, you can preserve healthy liver if you don't take some stuff. It's not about taking, it's about not take.
Okay, alcohol everybody knows. There are a lot of jokes about it, etc.
The thing is that the people not all the time realizes the most important thing is detoxifying is not detoxification itself.
But not to do it at all.
Right, stop taking toxin. That's the main thing, and alcohol, you know, they're one of the most important.
Okay, alcohol.
Yeah,
what else?
The problem with this is that everybody knows about alcohol.
Everybody. A lot of jokes about it.
Everybody.
Oh, my liver taking it, la 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 la. Everybody joking about
But the
it.
problem is that a lot of toxins people don't know about.
Like? You mentioned antibiotics, so I already...
No, antibiotics are mostly, it's not for liver, but it's for the microbiome, it's for the bacteria in the gut.
But sometimes we have no choice.
Liver, sometimes.
We have no choice but to take
Right,
antibiotics.
right.
Okay.
That's if we
What
don't
else?
have any choice.
Smoking too?
I'm not sure about smoking, but there is another toxins like the most common what I have seen is Chinese herbs.
You mean that people chew or like
Whatever, you know.
Any Chinese herbs?
No, I didn't say that. But you know, sometimes it's.
Give me a name of anything like one example, okay.
Well, let me give you an example from my clinical practice.
Okay.
It's emergency room. I have seen a woman who came with almost liver failure.
Wow.
And there was no other identifiable source except Chinese herbs. When they take Chinese herbs, they think they know what they're taking, but in fact they do not know what it is.
They're taking it from pharmacies, they're taking it from restaurant, or they're taking it...
Chinese food, Chinese herbs you can buy everywhere. Pharmacy, I don't think pharmacy itself is going to sell all this stuff. But it's so
What
common.
kind of herb specifically?
Any kind. Because, see, what we should be clear about is this. When they sell something, not the medication, nobody actually knows what it is.
But you do not assume that all Asian Americans in New York City have liver problems, you know?
No, I didn't say that. But what I'm saying is that there is no regulation and no way to check what they're actually putting in this stuff. You don't know.
Okay.
There is no mechanism. And basically there was actually one study when they started checking the supplements the people were selling, and they found out there are so many things that is not that is not on the list, including dangerous drugs.
Drugs, okay.
Yeah, so they put, but there is no mechanism to check.
Anything else?
No. Let me.
So Chinese herbs, drugs, alcohol.
Let me give you another example. Energy drinks.
Yeah, very popular.
Very popular. So what they do...
It's all over the place, everywhere.
Right. What they need to do is to make sure that the person who takes energy drink, they have a lot of energy, right?
Yeah.
But if they put too much damaging stuff, you know, people will notice it. So what they do, they cover it up with another component.
Orange flavor.
Another component.
Orange flavor.
Orange flavors. Supposedly, I want to just give the person a lot of energy, so I give him a lot of caffeine.
Caffeine.
But the people will start feeling that something is wrong. It's no good.
Yeah.
So what they do, they cover it up with an agent that, you know, prevents people from feeling that.
Okay.
Like taurine.
Okay.
That's a classic combination in the energy drinks. Caffeine with taurine. But the caffeine is still damaging, right?
Correct.
It's just we don't feel it. That's
Correct.
all.
Correct.
All right. And the same thing is here. They put something because they want an effect. They
Now
want-
you mentioned caffeine, but it means like regular coffee or even like
No, they put-
regular drinks with caffeine is
No,
not helpful for
I'm-
not healthy for your liver.
No, I'm talking about energy drinks.
Specific energy
Because
drinks.
they
Okay.
put a lot of caffeine,
Caffeine,
because
yeah.
they want an effect. They want to make sure that the people know why they're
Not
paying
just
the
straight
money,
away
right?
that
Yeah.
they're like.
Yeah, but what I'm trying to tell you is there's a lot of way to cover it up what they're giving.
And
In Chinese herbs, common reason for having a liver failure or elevated liver. I just recently had a guy who came to me with elevated liver enzymes, huge elevated, and the only source we found was Chinese herbs. So I told him to stop. Sent to gastroenterologist. Gastroenterologist told him the same thing. The person stopped, and his liver enzymes went down.
you're talking about energy drinks. Are you saying that people should consume less energy drinks now? What are you
No, I
saying?
think they're not supposed to consume it at all.
At all.
No,
But
why?
they're all over the places. Like Shipset Bay subway station. I'm coming out, there is a small refrigerator outside of the grocery store, all energy drinks there. And it looks like everybody taking it. And you saying if it's dangerous, then why FDA and nobody else is talking about it?
That's not that is covered by FDA, and you know.
Someone has to say something. American, but
I'm
what,
saying.
okay, you yes. What about American Medical Association or whatever, you know, like any organization?
No, listen, I'm not a member of American Medical Association.
Yeah.
I don't know what they're thinking about.
But this is association of doctors. You know,
I don't know. I don't know what they're thinking.
strange.
But this is ridiculous because you know it's a lot of things that damage.
So you're saying zero energy drinks? You do not recommend any of them?
Of course not.
Wow.
I have never
That's a
ever.
surprise for me.
Well. Have you ever seen a doctor who recommended energy drinks?
No.
I don't think so. Not a single doctor recommended. I at least have never heard of
But a lot of gyms that like promote like they offer it as well.
Listen,
They sell
let
it
me tell you something. People always say that if you want to stay healthy, do what monkey does.
Okay.
Have you ever seen a monkey in a gym? No, I'm just serious.
No, but a
I'm
lot of
serious.
people going to gym and staying healthy.
No, I'm serious. I'm serious.
But monkey jumping a lot.
Yeah. but-
Over trees,
right,
you know.
jumping.
People are not jumping too
But
much.
they're not jogging.
Not jogging.
They're jumping, but they're not jogging, and there is a huge difference because what they do.
And also they're like
Right,
hanging around
right.
on trees, etc., etc.
There's
On
a
branches.
huge difference because they give a lot of exercise, but it's very powerful, but very short period of time. And instead, when somebody goes to a gym, it's totally different type of exercise. They give an exercise low intensity, but for a long time. It's
But-
totally the opposite.
But a lot of people going to gym every day, for example.
So what?
And they're like,
I have never heard even a single study that proved that going to the gym improved anybody's health.
I saw many examples myself.
No, I'm
When
talking
people
about
go into
studies.
gym, losing weight, looking better, and improving their
But
health.
how do you
A lot
know?
of actors, a lot of
But how do you know
people
that?
who wanted to look better going there.
But how do you no look better? That's a different story.
No, but they're healthier. They have muscles. They're losing weight again and becoming healthier.
That's I have to disagree with it. No, let me explain you why.
Now we switch from liver to gym, but you surprised me.
No, let me explain you why. Supposedly, I will give you a little bit of extremes, but I want to make a point. All right. Supposedly, somebody decides to improve his health and go to the gym and give a lot of exercises.
Okay.
So what will happen to his heart? It has to pump more blood, right? So it gets bigger, right? More muscle, right? But the blood supply remains the same because there's no vessels, new vessels. So what happens if this person has a little bit of atherosclerotic heart disease? If he didn't go to the gym, the clogged or almost clogged vessel would supply only a small muscle, right? But in this case, after going to the gym, it has to supply a big amount of muscle,
Okay.
big mass of muscle. And obviously that in the second case, this vessel will fail much much faster, much earlier. And the damage will be much more.
You're a doctor, of course, I'm not.
No,
but I do not recall that people who go into gym on a regular basis have heart condition. I do not recall it.
But he doesn't know what he has. I'm not saying that somebody is going to heart condition, but what I'm trying to make a point, the more muscle you have, because the vessel is the same, it's much more dangerous.
I would prefer to switch back to liver.
Okay,
Liver
going back to liver.
Yeah, back to liver. Back to basics. you
Yeah,
know?
back to the basics.
So, alcohol is terrible for liver. Chinese herbs are very bad, and you mentioned energy drinks as well.
Energy drinks, not necessarily, but you know what energy drinks do, they put a burden on almost every part of the body. So I do not think that it's really healthy.
Coffee you mentioned?
Listen, who recommends coffee, you know? Well, once again, have you ever seen a doctor who recommends coffee?
But entire America is on coffee, come on.
I'm sorry?
Entire America is on coffee. Like Starbucks, coffee, Dunkin' Donuts, and coffee in general is like a symbol. You have to drink one cup, small cup of coffee every morning.
No, I don't. I am full
You
of
don't,
energy,
but you don't. But like it's like.
why would I drink coffee?
People say if it's a lot, if it's abuse, that's a different story. But if it's a little bit of coffee in the morning, it's like norm. It's like super American thing to do.
You know, that's why a lot of people come with headaches, and they do not realize that the reason why they have headaches is drinking coffee. And the first thing when somebody comes and the person with headaches and MRI is normal, so there is no tumor, the first thing to say is to stop drinking coffee. Because that's the reason why they have this.
Today you surprised me already several times.
Well, that's every
Coffee
neurologist
is like
knows this.
in America. Listen, like everybody, let's have a. Even when they say let's meet, they said let's have a coffee. You know, coffee is like lifestyle basically.
Well,
it's like
it's addictive.
It's
that's
a
why.
it's a part of life.
It's
And you're
because
saying
it's
it's dangerous for your health.
It's addictive. It's addictive. Let me give you another example. There was a recent study that showed that the combination of carbohydrates, fat, and salt is as addictive as cocaine. I am telling you.
Okay, coming back to liver. So you're saying the most important to preserve healthy liver is not to consume unhealthy stuff, like you mentioned.
But also what I want to mention is that basically it's much more even dangerous than Chinese stuff. Is just to be careful in terms of getting some viruses. Okay, because virus can damage your liver. You know, it's unbelievable.
What kind of virus you're talking about?
Hepatitis.
Hepatitis
B,
yeah. I've heard about it.
hepatitis
Yes.
C,
Yeah,
you know,
B.
so people have
Yeah, I've heard
to
about
be
hepatitis.
very,
So it's
very
like
dangerous.
it's like infection. You can get it from someone else.
Right.
Contagious.
People need to be careful. You know, no needle sticks because hepatitis B is extremely contagious.
From where? From other people or from I don't know.
Sexual contacts, yes. Hepatitis C is not as contagious, but still. Okay, and that's pretty much it about hepatitis. So people have to be very careful.
So how can you be careful? How would they know that someone else has hepatitis B, for example?
Well, a spouse supposedly.
Okay, spouse, you know.
Spouse is sexual contact. You know, you have to check
But
it out.
is it possible that children in school will get from someone?
It depends on if there is a needle stick can do that, and the sexual contacts, yes. If the children in the schools, they usually do not realize what they are doing, you know. And but another thing is this: everybody knows about hepatitis. Everybody knows about alcohol. They don't know about Chinese herbs,
Yes.
and also fat. Non-alcoholic fatty liver disease is very damaging.
Okay, how to prevent it?
Carbohydrates.
Like rice?
Rice, bread.
You mean to eat less? That's what you mean.
No, listen, in my understanding...
You always going to extreme.
Yes, so not necessarily, listen, what I'm
Eat
saying...
less, not completely eliminate.
No, not completely eliminate, but once again, if you want to stay healthy, do what monkey does. You know, so monkey eats bananas, you know.
Bananas, yes.
So no problem with this, but you know, you can't eat...
Maybe monkey also will eat cake, I don't know. If I never tried, but maybe they will.
Hold on. Monkey, I've never even thought that in the Mother Nature, in the woods,
Not in the Mother
jungle,
Nature, but I never tried. But maybe if in a zoo you will suggest to monkey to give some kind of cookie, I think they will eat.
No, listen, they
Huh?
will, but
Always.
doesn't mean that they have to. They do it in the jungle.
No,
What we are talking about.
definitely not in the jungle.
Yeah.
But we do
No,
not live in the jungle. We live in the city, you know.
That's what hurts us. That's what hurts us. I am sure that if we live in the jungle, we probably would be much happier.
Okay.
Can you imagine do nothing, just a lot of food around, you know.
So let me summarize because we covered a lot of ground.
No
today.
arrest, nothing.
Yeah, that's true. So first of all, drink less alcohol. So I don't think people will be able to stop completely. Some do, but not everybody. At least try to limit consumption of alcohol. According to you, Chinese herbs are very, very bad.
Well,
so I would say totally eliminate.
No, I would never take any Chinese herbs.
Okay. Energy drinks as little as possible too. Also limit or none. None.
Why?
Be careful in terms of hepatitis B, hepatitis B
Yeah, and see.
and C, and less rice and
Carbohydrates,
cookies
no,
and
carbohydrates.
bread and all kinds of flour
Yeah,
stuff.
the most important thing is to realize that what is addictive? Addictive is a combination of fat.
One second, you're saying
carbohydrates, and
that
salt.
our liver will be in a bad shape if we constantly consume cakes and cookies. I'm not talking about becoming overweight, I'm talking about
No, I'm not talking about that. Liver, right.
Bread is
Yeah.
bad for liver? That's what you say?
As soon as liver becomes fatty, that's it. A person may not necessarily be overweighted. I'm not saying about that. But the liver can contain fat. and
But
it
again,
damages
like
liver.
so many people would be like, what doctor is talking about? Like, how
Oh.
can we eat without bread?
Look, this is a free country, you know.
Yeah.
And I can tell whatever I want.
That's your suggestion that bread is even like limited amount.
You
is
know
bad
what?
as
You
bread.
know what? There is a very interesting thing. By then I learned that there is quite recently. So people are saying that bread is damaging because of the gluten. And there is a controversy about gluten because not everybody actually we can prove that he's sensitive to gluten. But a lot of people are saying that
But
bread
relationship to liver is surprising, you know.
it's interesting. Basically, what they found recently that the sequence, amino acid sequence in gluten, is it looks alike bad bacteria. And what happens is that what might be the reason why we should not eat bread is because as soon as bread comes into our gut, our body recognizes as a bad stuff and starts attacking it.
Trying to throw it away.
Yeah, exactly. So listen, I am gluten-free
Okay.
for many years, probably about close to 10 years.
Now it's very popular in America. This gluten-free stuff is becoming more and more as obsession.
Right. And I think that's a good trend. However, I don't think that even 1/10 of my patients are gluten-free. I don't think so. I can say that probably 1 or 2, but no more than that.
Because it's very, very tough to follow such a diet, you know.
Well, in fact, it's not. As soon as somebody is gluten-free for about half a year, he cannot go back to gluten. Because what happens is that in this case, he has abdominal pain. If he goes back to gluten, abdominal pain, diarrhea, and they quit gluten for life.
Got it. Thank you so much, Lisa.
My pleasure.
I learned a lot today.
Thank you for coming.
Hope
and
we
see
did
you
not
next
scare
time.
you, but like some limitations should be done.
Okay, thank you.